This topic is hypercalcemia. When we look at the word hypercalcemia, we have the prefix hyper, meaning high, the root word calc, referring to calcium, and the suffix emia, meaning present in the blood. Therefore, the word hypercalcemia means high levels of calcium within the blood. We diagnose hypercalcemia when a client has an increased serum calcium level that is greater than 10.5 milligrams per deciliter or 2.62 millimoles per liter. Let's talk quickly about how calcium moves throughout our body. First, calcium is primarily absorbed within our gastrointestinal tract, eventually becomes stored within our bones, and lastly gets eliminated by the kidneys. Hypercalcemia can result from any change within this process. Therefore, we can expect calcium levels to rise due to increased absorption within the gut, and this can occur from excessive oral intake of calcium and vitamin D, because vitamin D helps us to absorb calcium within our diet. Decreased calcium excretion can lead to high calcium levels, and especially if the client is taking something like a thiazide diuretic, which helps to reabsorb calcium within the kidneys. Another way we can develop hypercalcemia is from increased bone resorption of calcium. Now remember, resorption is not the same as reabsorption. Resorption refers to the process of bone breaking down and building itself back up. And during this process, this can lead to excess calcium being given off into the blood vessels. Before we talk about some of the conditions that can cause hypercalcemia due to this bone resorption of calcium, let's first talk about two hormones that are very important when it comes to absorbing and getting rid of calcium. The first is parathyroid hormone. Parathyroid hormone is primarily responsible for increasing serum calcium levels. And this can occur indirectly from increasing osteoclast activity, which helps to break down bone and releases calcium into the bloodstream, from increased absorption of calcium in the GI tract, and parathyroid hormone's effect on the kidneys to reabsorb calcium before it's eliminated. Calcitonin is another important hormone when it comes to talking about regulating calcium levels. We want to think of the effect of calcitonin as almost being the opposite of parathyroid hormone. So instead of increasing the levels of calcium within the body, calcitonin will help to decrease the levels of calcium by making sure that we reabsorb calcium into the bone, decrease the amount that we're absorbing in the gastrointestinal tract, and increasing elimination through the kidneys. So when parathyroid hormone levels are increased, or if calcitonin levels are decreased, this can lead to a relative increase in our overall calcium levels. One way that our parathyroid hormone levels can be increased is through hyperparathyroidism. So with increased levels of parathyroid hormone, we get that increased absorption and reabsorption of calcium from the GI tract and the kidneys, and an increase of release of calcium from the bones. Another condition that can increase the amount of calcium released from the bones is any type of malignancy in the form of bone cancer. One final way that calcium levels can increase within the body is due to hemoconcentration from dehydration. Calcium levels will increase due to the relative amount of free water within the blood. Therefore, if levels of free water are reduced, this will lead to a general increase in the amount of calcium within the blood. Typically, we're not going to see symptomatic hypercalcemia until levels of serum calcium reach 12 milligrams per deciliter or 3 millimoles per liter. And the way that this increased level of calcium is going to behave within the body is that it's almost going to act like a diuretic and a sedative. Large levels of calcium will pull water from the extravascular space into the intravascular space. And as the kidneys filter this blood, this can lead to the process of polyuria. Essentially, the client begins to urinate quite frequently, which can lead to dehydration. And we may notice that the client develops polydipsia, or an increased thirst, and may be drinking quite excessively. Now, at appropriate levels, calcium helps to regulate nerve and muscle function. Increased levels of calcium, however, will lead to a sedative type effect on the nerves and muscles themselves. So we can anticipate the client developing things like muscle weakness, which can lead to paralysis and decreased reflexes. Additionally, the client may have decreased intestinal peristalsis, and when this occurs, the client can get constipated. As a muscle, the heart can also be affected by serum calcium levels, and increased levels of calcium can lead to the development of certain cardiac dysrhythmias. And if hypercalcemia is severe or occurs rapidly, the client can develop lethargy, confusion, and stupor, and could even end up in a coma. During treatment, we should monitor the client's serum calcium levels and report any level greater than 10.5 milligrams per deciliter or 2.62 millimoles per liter to the healthcare provider. We should treat the underlying cause of hypercalcemia, which means that the client may need to have a parathyroidectomy in the case of hyperparathyroidism, or radiation or chemotherapy if they have bone cancer. The client should increase oral intake of fluids, and in a similar vein, the nurse can administer IV 0.1% sodium chloride in order to help dilute serum calcium levels. Bisphosphonate administration can help prevent bone breakdown and subsequent release of calcium into the bloodstream. And administration of calcitonin can increase absorption of calcium back into the bones. In this way, both of these medications can help reduce the overall levels of calcium within the blood. We should discontinue calcium-containing medications like calcium carbonate that's used for indigestion, and discontinue thiazide diuretics. That way, the kidneys will stop reabsorbing as much calcium and will choose to instead eliminate it. While treating the client, it may be appropriate to place them on continuous cardiac monitoring to rule out any cardiac dysrhythmias. And the client's level of consciousness should be monitored to make sure that calcium levels aren't getting excessively high, which would lead to lethargy and the development of confusion.